I request you all to please stand for our Kulgeet. Saraswati Vandana. I request you all to please keep standing for our Kulgeet. Following this, we have the honor of witnessing a symbolic gesture that signifies growth and nurturing. I request our principal, sir, Professor Kamal Kumar Gupta, to felicitate our guest speaker, Dr. Avtar Singh Meena, sir, with a sapling. Thank you, sir. Now, I request Dr. Sandhya Rai ma'am to felicitate our principal sir, Professor Kamal Kumar Gupta, with sapling. This sapling represents the root of knowledge, taking firm hold and branching out. Thank you, ma'am. Now, I request Dr. Jitendra Kumar sir. Moving forward, it's time to invite Dr. Sandhya Rai ma'am for the convener's note.
Thank you, Akansha. Good morning, everyone. Respected Principal Sir, Professor Kamal Kumar Gupta, our distinguished speaker, Dr. Avtar Singh Meena Sir, my team members, Dr. Jitendra Kumar, Mr. Mohammad Shehzad, Mr. Arun Shokar, respected faculty members and dear students. It is with great pleasure that I extend my warmest welcome to you all on behalf of Department of Zoology, as well as Health and Wellbeing Club, Deshbandhu College, to the event of alcohol awareness. As Mahatma Gandhi has said, it is health that is the real wealth and not the pieces of gold and silver. Health, according to modern concepts, is more than just the absence of diseases. It represents maximum potential of the individual for self-realization and self-fulfillment. That means healthy living enables one to lead a fulfilling life with meaning and purpose. Your life revolves around your health, and every part of your life relies on you having good health. So that's why recently college has constituted Health and Wellbeing Club under the dynamic guidance of respected Principal Sir, Professor Kamal Kumar Gupta, with the aim to spread awareness among faculty as well as students about the physical, mental, emotional, and social well-being by organizing different activities and events. This is the inaugural event of organized by the Health and Wellbeing Club in association with Department of Zoology on the very important topic of alcohol awareness. Alcohol use is typically established during adolescence, and this can have negative impacts on one's short as well as long-term health and social outcomes. An estimated 25% of Indian men suffer from alcohol dependence, and of course, this is a very serious public health concern. As we all know that excessive alcohol consumption can lead to several health problems. As per the report made by the Ministry of Health and Family Welfare, Ministry says alcohol consumption contributes to liver cirrhosis, cancer, has adverse effects on fetal development during pregnancy, and leads to alcohol dependence. Driving under the influence of alcohol also increases the risk of severe, even fatal, motor road accidents. Furthermore, it has negative impacts on mental as well as social well-being. In this, we can all do our part to prevent alcohol misuse or abuse. This event is an attempt to raise awareness about alcohol abuse and take action to prevent it, both at home and in the society. We also organized a poster making competition yesterday as a part of this program, Alcohol Awareness, with the theme Alcohol Abuse Harms Tissues, Health, Family, and Society. I must mention that our students participated enthusiastically in the event and embraced the opportunity to share their message via their art, focusing on the importance of alcohol awareness. Many, many congratulations to all the dear students for their great efforts. Today, we are lucky to have distinguished speaker, sir, among us. Thank you, sir, for coming. We are eagerly waiting to listen to you and get enlightened on this crucial topic. With this, I end my convener's note. Thank you.
Thank you, ma'am. Now, I would like to request Dr. Jitendra sir to shed light and introduce our guest speaker to the audience.
Good morning, all of you. Dear Principal Sir, esteemed colleagues and students, it's my honor to introduce our keynote speaker for today, Dr. Avtar Singh Meena. So Dr. Meena is an accomplished professional with a diverse educational background and extensive experience in the field of biotechnology. He earned his PhD from National Center for Cell Science, Pune in biotechnology, and a PG diploma in intellectual property rights from IGNOU, a PG diploma in business administration from Symbiosis Distance Learning Institute, Pune, MSc from MSU Baroda, and BSc Honors Biochemistry from Sri Venkateshwara College. So before joining, currently he's working as an assistant professor in Department of Biotechnology, AIIMS Delhi. So before joining AIIMS, he's contributing as a scientist at CSIR CCMB Institute, that is Center Cellular for Molecular Biology. He has made significant strides in his academia and research. He has international research experience, first as a postdoc and then later on as a faculty instructor at the University of Tennessee, Memphis, USA. It spreads through 2015 to 2020. Dr. Meena's research contributions are notable with a focus on complex bidirectional communication between the gut microbiota and liver in relation to alcohol consumption. He has more than 300 citations with H-index 20, I-index 21, published more than 30 publications, including 10 first or co-first author publications, and in the prestigious journal like Molecular Cancer and Cell Reports. In addition to his research endeavors, Dr. Meena has received several accolades for his outstanding contribution, including the Senior Postdoc Achievement Award from University of Tennessee, Memphis, and Travel Award from Research Society on Alcoholism and Alcohol and Immunology Research Interest Group, DS Kathwari Fellowship for Postdoc, ICMR's Centenary Postdoctoral Fellowship, Senior Research and Junior Research Fellowship from CSIR during his PhD. So Dr. Meena's multi-dimensional expertise from academic achievements to groundbreaking research makes him a distinguished figure in the field of biotechnology. Please join me in welcoming Dr. Meena to share his valuable insight and experiences with us. Thank you. Please.
Thank you, sir. Before we start our today's talk, let us call our principal, sir, to please share his words of wisdom with all of us.
Thank you. Good morning. Namaste. It's an honor for me to be here with the August gathering. And at this occasion, first of all, I'd like to welcome our distinguished keynote speaker, Dr. Avtar Singh Meena. Welcome you, sir. I appreciate and praise the efforts of convener, Dr. Sandhya and Dr. Jitendra, Mr. Shazad. And this event is, of course, for all the students. So welcome everyone. All the students, ladies, gentlemen, boys, girls. Now, when we look at the genesis of this event is very special because, first of all, this is an inaugural session of Health and Wellbeing Club. There was university circular to have awareness program under the WUS Health Center and Department of Zoology. So it's very, very special event, at least for me, a person from zoology. Now, few weeks back, I remember this was my desire that we have so many societies, so many activities in the college, but we are simply neglecting and ignoring the health, which is the most important. That is one thing. Then is it just health or something more what is required? So health, then we, like me and Sandhya, we were discussing and we started, why not to have a club called Health and Wellbeing Club. So that was the beginning. And just within 2 weeks, if I'm not wrong, Sandhya could come with a proposal and we have such a lovely event. I was thinking that I will share a couple of things with you, but Sandhya has already spoken everything. So I will just summarize a couple of things. You know, whenever we talk about the health, first of all, I was willing to say when the Saraswati Vandana was there, Saraswati should bless all of us with wisdom and also the health. Whenever we talk about the health, normally we say bukhar ho gaya to health nahi hai. But it is not only fever, it's not the physical. WHO clearly defines that health is physical, mental, and social well-being of a person. And at my age, I extend the definition further, that in the spiritual well-being also, because many times we may be well health, as far health is fine, we are fine as far as the mental part is concerned, socially also, but spiritually we are not. If we are spiritually fine, then all the problems, all the ailments will be over. So I want to include the spiritual also. Now, the topic is very much apt and relevant when we talk about the alcohol abuse. As she rightly said, that at the adolescent, that they're the most prone age, most sensitive age. We start with one, and then is a fun, and gradually it leads to addiction. That is. So, and then physical ailments, as she rightly mentioned, that cirrhosis, cancer, and all the things. So it affects physical health, it affects mental health by the addiction and dependence, and also social health also is affected, because at the end, many of the families, they don't have money to feed the children, but the addict, they drink. So in fact, it's really curse, and still in India, it's a very, very prominent, it's really problematic. So the topic for the 2 days awareness program is very apt as far as the purpose is concerned, as well as the gathering is concerned. And we have a learner scholar with us, Dr. Avtar Singh. So he will throw a light on all these things. And I really wish, I always give a message to the audience, let it be an interactive session. So you can also come with some of the issues, some of the queries you have. So when we have such a learner scholar, he will be able to give satisfactory answer. So thank you, congratulations, best wishes, and let all of us in Deshbandhu College lead a healthy life, and we believe in the well-being of each and everyone. Thank you.
Thank you, sir. We are privileged to have a remarkable personality with us today. I invite our distinguished guest speaker, Dr. Avtar Kumar Meena, sir, to address the gathering.
It's okay. Am I audible to all? Yeah. So good afternoon, first of all, and namaste as sir did, because Hindi is our matrabhasha, and I thank to Dr. Sandhya, who have already given you what are the different actually nullified or like bad effect of alcohol, and my actually talk is also pertinent to that particular issue, and very thankful to Dr. Jitendra, who given a wonderful introduction. At least some of the things I already forgot, because it's a very long actually history he have told me about myself. And so my topic for today is the role of calcium channel in alcohol-induced tissue disease, or you can say tissue injury. So I have been asked to actually, since audience is mostly the bachelor's degree student, so it should be like little bit basic, and then half of them is like more of scientific knowledge. So I'll start with basic first. Okay. So is there any online audience is there? Yes. Okay, okay, okay. So there is no other people who is attending online. Okay. So first half will be like more of basic. What is alcohol, how it is causing, and what are the actually effect on society, family, so many things, and how people are addicted to alcohol. And later on in the half of this presentation, I am going to tell about what are the research we have done and what kind of different kind of research we are doing, and what is my lab actually doing. So as such, it is affecting not in India, it is affecting everywhere. And in India, we are also growing economy, and people are like having a lot of money in the market, and they are earning so much money that they are actually purchase or like buy these kind of addictive drugs. Actually, it's a drug. Alcohol is a type of a drug, psychoactive drug. So in worldwide, there are 3 million deaths every year due to harmful use of alcohol, that represent 5.3% of all death. It means it is not directly causing the death of the people, but indirect way also people are dying. That is maybe because of accident. People are drinking, and after that they says, okay, I am going to drive, and then that is the main concern. And in addition to accidents, there are other things as well, such as cirrhosis, cancer, which is very, very risk factor for people who is consuming alcohol. And it has the harmful use of alcohol causes more than 200 disease and condition, and not only death, but also it is significantly affecting social and economical life of an individual, or in as in society at large. So alcohol consumption causes death and disability relatively early in life. So people, there are two kind of people actually drinking. First is, we have a legal age of 21 years old. I think that is throughout everywhere is almost same. But because of the curiosity of the young individuals, they are actually drinking at the age of 13 and 14. So whoever is drinking at the age of 13 and 14, they are very prone to alcohol use disorder. There are actually different terms, alcoholism, but alcoholism is not a proper term. So as per standard unit, we are calling as alcohol use disorder, AUD. So there are chances that people like students in the early age, when they drink at the age of 13 and 14, they are very, very prone that they will be alcoholic dependent person in the society. So in people aged 20 to 39 years, approximately 13.5% of total death are attributable to alcohol. And it is alcohol use disorder is characterized by like person who knows this is bad to me, but still they are drinking. So it means it is the inability to control or stop drinking despite they knows that these are the negative consequences. Symptoms of alcohol use disorder, that is craving, like when they drink first, when they take one drink first, then they little bit after some time they thought, okay, I need to drink one more. That's a craving. Actually, they cannot inhibit that craving. So they are always wants to drink something, either maybe in the party or somewhere else. And loss of control, that is because of the craving is more, they are losing their control to control that how much they are going to drink. And physical dependence, like person who is already had a alcohol in the previously, but whenever they are actually leaving, means kind of like they are getting more of withdrawal symptoms. Like they are like, okay, I need to drink more because I'm not getting excited. I am like more of depression. These kind of significant actually they are actually observing. And tolerance, like when people have started or they started to drink one drink at a time, later on the same drink cannot give its positive effect. So they are relying on the second drink, third drink. So that tolerance level is usually increased. That is means they are actually addicted to that particular amount of alcohol. Neglecting responsibility, which is one of the symptoms. Like they are not seeing how their kids or parents are doing, whether they are going to school, or even the person who is drinking, they are also absent from their office, and that reduce less productivity and that is contributing to our GDP in India. And continued use despite negative consequences. So this is scenario of global burden that we are seeing. But our India also facing this kind of burden. It's not working. So in India, actually, there are approximately 2.5 lakh deaths every year because of harmful use of alcohol. And that is because of approximately 1 lakh are dying because of indirect alcohol abuse. Means they are dying maybe in the road accident, and 30,000 people are dying because of the cancer. That is, alcohol is causing that cancer. Previously, it was reported like there were many people are working worldwide. So what they have observed that alcohol was initially increasing the risk of cancer, but later on the people or researcher, they have actually set together and they figure it out. Okay, so the model that actually we are using in mouse model, these are not relevant or adequate model. So what they have done, they have given that alcohol throughout the life cycle of their mouse colony. And what they have observed, that these mouse, irrespective of what, when they are drinking alcohol for the entire throughout life, they are actually having cancer. That could be many cancers, maybe hepatocellular carcinoma, colorectal cancer, and breast cancer, which is very, very common because of the alcohol abuse. Liver cirrhosis is one of the factor, because in India, we are seeing a patient for NFALD, non-alcoholic fatty liver disease patient. So the person who is having grade 1 fatty liver, later on when they start drinking, even one small glass of wine is also actually contributing that progression of NFALD, and the people then become into alcoholic fatty liver disease, like alcoholic liver disease model. So liver cirrhosis is the biggest health problem posed by alcohol use, with approximately 1.4 lakh death every year. This is the scenario of the India, and it is going to be expected that it's going to be rise because of more amount of alcohols are selling these days because of not strict policies actually we are having. And these are the recent, actually there is no evidence at all that drinking alcohol can improve health. So I'm not going to scare you guys that, but this is the problem. Whatever things even if you ingest or eat in large amount, that is going to give health consequences. And there is no evidence found to prove that light drinking might help in keeping people healthy. These 2 points I have put it here because previously people were saying that if they will drink little amount of alcohol, maybe in a month, that is going to improve their health. But this is not the case, because there are so many things actually alcohol affect. Alcohol affect your liver, alcohol affect your brain. So in that brain, sometimes people are getting excitement or energy. They are getting energy because of the alcohol consumption. And because of that, they are thinking, okay, in the last time I got like a lot of energy, so now I'm going to get same energy again because now I'm maybe anxiety or depressed mood. But this is not the case, because the level of whatever neurotransmitters which is released from the brain, that level is already disturbed. So these are the alcohol's effect on society. First is financial cost of alcoholism. So these days, whenever you, I think if I'll talk about Delhi case. So in Delhi, I think during COVID time, people have purchased a lot of alcohol because of government has given buy 2 get 1 free. I was not in Delhi that time, but this was the things I have actually read. So we have to stick, because sometimes, as in like government says we are getting a lot of profit because of the selling of alcohol. But in addition, if you have read paper, then you said like selling of alcohol contributes 2% of GDP of India. But in addition, we are actually losing money as well. Like in terms of 1.5% of GDP, we are losing because of the harmful use of alcohol. So it's not a profitable industry that actually we are living right now. So it should be careful. So it is not actually boosting economy, but it is affecting economy in terms of productivity, in terms of hospital cost that is associated because of the alcoholism, and the effect of alcoholism on crime, because the person who is influence of alcohol, they do more crime because of aggressive nature, and they go for murder, this kind of thing. And mental health, anyways, because it's a dependency model, but person who is drinking alcohol, in the next time it is more dependent, so they are at least changing those mental condition of that particular person. Work performance, the person who is drinking alcohol in the night, next day maybe he's tired, he don't want to go office, which is contribute to less productivity. Relationship in terms of family, life partner, partners, so that is also affecting because of the alcohol use disorder. Family is same. And alcoholism and fetal alcohol syndrome is very, very common. Dr. Sandhya already mentioned that we are, even we also have performed an experiment in that. What we have done, we have given a alcohol to the pregnant female of mouse, actually mice. So when those pups born, those pups actually, when they become adult, so they do have this social defeated. So they were not interacting to their families. So that's a model, like person who is like lady who is a pregnant and drinking alcohol, their baby will have this memory impairment and coordination, social, they will not, like they will, the kids will be in like social isolation. So these are the effect on the society that alcohol caused. Next. So when person is drinking alcohol, how you going to measure like how much alcohol is affecting their entire brain and coordination? So that level says blood alcohol concentration. So it is like the percentage of alcohol in a person blood stream. So that could be the different ratio, like there are some percentage. It starts from, you can say 0 because that's a sober who have not drink, and it goes to whatever the level you can achieve. But after that, some level, people is dying because of the alcohol. Next. Yeah, so the person is intoxicated. Intoxicated means the person who is drunk. And that is actually defined by various factors, such as age. I already told you, like the person who is young, they are metabolically active. And the person who is old, they may have more immunosuppressants, immune dysregulation because of immune system compromise during aging, and that is causing intoxication. Another one is tolerance, which I already mentioned. Race ethnicity means some Asian people who are having some enzyme deletion of enzyme, then they are not able to consume that entire alcohol because of because metabolism. I'm going to talk to you in a couple of slides later. Genetics, body mass, gender. Gender means females are more intoxicated compared to the male. The reason is because of smaller in size and less volume of the female compared to the male, and more fat index in the female compared to the male. And so here in this example, showing there, स्क्रीन पे नहीं यहाँ तो दिख रहा है, यहाँ नहीं दिख रहा है स्क्रीन पे. Okay. So as you can see, if there are two actually, female and male. So if female is 120 pound is the weight, and male is 120 in the same category, you can see person who had female who had one drink is equivalent to 0.05, and the male will have 0.02. So you can see directly from this figure that female are more having this effect of alcohol is more in the female compared to the male. So these are the different back concentration, that is blood alcohol concentration. The person who is having 0.0 to 0.05, they have these kind of symptoms. Mild speech, means more of, like, you can say mild impairment, speech, coordination, and balance impairment. And they think that these are having beneficial effects such as relaxation, which is not the case. And as soon as that back level goes up, then it leads to increased risk of aggression in some of the people, not all of them. Speech memory also will be more impaired, or augmented effect is observed, and significant impairment in driving skills, and increased risk of injury. As it goes up 0.16 to 0.30, that also increases these impairment, and life threatening is 0.31 to 0.45. So how you are going to increase that back? That's your question. So the back is only increased when there is a time period. If person is drinking 1 alcohol in an hour, they may have this back. But if they will drink another glass of wine or beer, then that within hour it can goes up. So these are the different coordination. In 1 year, in 1 hour, how much they have consumed, that is the back concentration. So people, like previously they were saying there is a moderate amount of alcohol is good. So they have recommended that for women it is 1 drink per day, which is equivalent to 45 ml of whiskey. And for male is 2 drink per day, that is like 90 ml. So 90 ml for male and 45 ml for female, which was recommended previously, but now there is no safe limit. So then in the heavy category, it can increase to 4 drink per day or 5 drink per day for female and male respectively. And binge drinking is 4 drink within 2 hours. So by that time, this back concentration goes up. And these are the alcohol abuse links to common disease. One is brain nervous system, that is very, very affecting. It is like within 30 seconds, your brain is getting that kick from alcohol. That is, means alcohol causes poor muscles coordination, slurred speech, memory issue, and brain shrinkage. Mouth, throat, because the person who is drinking, this is the first site actually that alcohol interact. And it has been observed that because alcohol is converted into some metabolites, that metabolites is 10 to 100 times more in the mouth compared to the gut. So that is responsible for oral cancer or esophageal cancer. Kidneys are also affected because then it affects the entire absorption and reabsorption of nutrients. Immune system is also compromised. Heart it raises blood pressure, which is also contributing factor. And breast, which is very common because of the women have a greater risk of developing alcohol-related breast cancer, even a moderate amount of consumption. Liver is, I am going to talk to you, that is my lab is working on. So what are the treatment of alcohol use disorder? Some is detox or withdrawal symptoms, and that is can be done at hospital centers. Learning new skills, because the person who is already having these alcohol abuse, then they go for learn new techniques, new skills, so that setting of goal just to avoid that they don't miss that entire alcohol to drink. And psychological counseling is one of them, either in the family therapy or couple therapy or at individual level. Oral medications are also prescribed the person who is not able to stop it. So one is disulfiram, which is not actually depleting the level of alcohol, but it is actually preventing the person who drink more. So either maybe it is causing vomiting or nausea kind of condition. Because of that, people will not drink. So the disulfiram is not like a directly affect, but it is preventing the people to drink alcohol. And naltrexone, that is blocks good feeling which alcohol usually produce. Acamprosate, which is stop craving of the alcohol. And injected medicine, Vivitrol, which is also works through the same mechanism of naltrexone. Means they will not feel that the feeling actually people are drinking alcohol. Continued support from family members or changing necessary lifestyle. I think you guys are watching movies, you have seen people are drug addicted, they are going in some room, they are talking with the people, that's a support group. So they are talking what are the different problems they are facing in their life. Spiritual practice and alternative medicine, yoga, medication, or acupuncture. So we have to reduce this burden, actually, the burden which we are getting from the alcohol use. So these burdens can be actually reduced by some mechanism. One is marketing regulation. So I think whenever I see advertisement during match or some good movie, we are seeing some Royal Stag, what do you call it? Some ad are coming. It's a soda, but ultimately they are actually propagating their what is. People who is drinking, they know what they are. So we have to control actually these as per in like marketing regulation, ads, sponsored advertisement, and controlling the limiting the availability of alcohol. That is can be done through the government policies. And drinking driving policies, like whoever found that after drinking he is driving, we have to give like severe punishment so that that practice will not be again will happen. And through taxation and pricing mechanism, but this is opposite the case. Actually, we are seeing because buy two get one free, you guys have already seen. So taxation, we have to increase taxation and the pricing mechanism. That is some of the government in some of the state government, they have implemented, but some of them are not. Promoting awareness, what are the different actually causes that caused by alcohol, that awareness that we are doing right now. And affordable treatment, if person is having diagnosed with alcoholism in terms of cirrhosis or cancer, then affordable treatment should be available to them. Brief intervention program and accessibility and affordable treatment for people with alcohol use disorders. And these are the for the young people, whoever actually they have started drinking. So we have to implement 21 years of age of drinking, but we have to stop or prohibited the sponsorship and advertisement, which is usually companies are putting whenever there is an athletic event or concerts are happening. Local or state government prohibits or restricts drink special such as sale of 2 alcoholic beverage for the price of 1, which was here. And sometimes what happens, these students, when they are drinking, well, like below the age of 21, they are making these fake IDs. So government should have actually put a restrictions that whoever found with fake ID, they have to seize that ID and inform their parents, or sometimes they interchange this ID with each other people. That is also have to be taken up by as in responsible person from India or government. So this is like more of basic like awareness, what are alcohol, what are the side effects, how these side effects can be limited, or we can actually mitigate the effect. But now I'm going to talk about my research. So ethanol as such, you know, these are having people are drinking from mild to severe or large consumption. So and that is like person who is drinking alcohol, they have these kind of problems like impairment development, psychological, mental, physical, they are affected because of the alcohol abuse. And that cause craving, irritability, antisociality, depression, anxiety, panic, psychosis, hallucination. There are so many things actually. The name it is caused by alcohol. And vision changes, ataxia, and the blood like anemia, because that decreases hemoglobin level as well. Heart, alcoholic cardiomyopathy, because alcohol, the person is drinking alcohol, they are getting more fat because of the generation of triglyceride, and that triglyceride is blocking the heart to pump more blood. And in the liver, cirrhosis and hepatitis is very common. And these days it is observed that person who is drinking alcohol, and along with if they are already having infection with hepatitis B or C, that is worsening the entire symptoms. Stomach chronic gastritis is the common one. pancreas, pancreatitis. So these are the actually effect of alcohol on the body. So you can see there are so many organs which is very, very important or significant, play significant role in overall health. That is also compromised because of the alcohol consumption. So how alcohol is absorbed? कैसे alcohol absorb होता है? So when person is drinking, there is no absorption up to here. But after it reaches to stomach, so when the person is drinking alcohol, in the saliva, that just only little bit of absorption is there. So that absorption is actually some of the bacteria which is present in the saliva, they change that alcohol into different metabolites. That is maybe acetaldehyde and to acetate. Acetate is a fuel for energy source and acetaldehyde is a poison actually. Alcohol is a poison, acetaldehyde is a double poison you can say. And after that it goes to your stomach. In stomach, it is approximately 22% are absorbed, and after it goes from stomach to the small intestine, mostly to the duodenum part of, because small intestine is divided into three parts. Duodenum is the first one, then jejunum, and then ileum. So duodenum is the place where most of the alcohol is absorbed. So 75% you can say. So after absorption, so if you say this is inside of the small intestine, that tube, so this alcohol goes into the interstitial space through the epithelial cells. So they have to face epithelial cells, and my lab is working on these epithelial cells, the effect of alcohol on these epithelial cells. And after that, it goes to capillary, and through the capillary to the blood circulation. Now it is coming into the blood circulation, and it is reported that the amount of alcohol present in the saliva or present in the blood, colon, all are same concentration unless how much person is drinking alcohol. So this is like after drinking, in 30 seconds, it goes to the bloodstream and travel to the brain. So within 30 seconds, person who is drinking alcohol, they get that kick. And after 5 minutes, it enters to stomach, and where small amount remains and it expelled through the breathing and sweating. After 20 minutes, it goes to small intestine, pancreas, liver to be metabolized. So up to 12 hours after consumption, this is the time period where people can actually figure it out whether they are alcoholics or not. So these are the major pathway of alcohol metabolism. So alcohol is converted into first into acetaldehyde, which is a toxic, and from acetaldehyde into acetate. And there is another pathway which actually is in the microsomal ethanol oxidizing pathway, where there is CYP2E enzyme, cytochrome P450 cytochrome enzyme 2E1, which is responsible for conversion of this ethanol to acetaldehyde. So this is a normal pathway from ethanol to acetaldehyde. So in this acetaldehyde is converted into acetate in the liver. But there are places in the gut, in the mouth, this enzyme is very, very low amount. Even the female also have very low amount of aldehyde dehydrogenase. So this is alcohol dehydrogenase. This is aldehyde dehydrogenase. So aldehyde dehydrogenase is very, very limited, or the amount is so small that more buildup of acetaldehyde is occurred. And the person who is drinking more and more and more in a period of 1 hour, then this pathway is activated, CYP2E1, and this will again convert acetaldehyde, but in addition, it is also producing reactive oxygen species, which is causing oxidative stress. Next. So after this acetaldehyde produced, so it is producing more NADH production, which is involved in increased fatty acid synthesis and reduced oxidation of fatty acid, and that is causes fatty liver, more fat buildup in the liver, fatty liver. And it acetaldehyde also causes lipid peroxidation, that is involved in hepatocyte injury, and liver injury is because of the hepatic stellate cells are also activated, and that increase collagen synthesis and liver fibrosis. And alcohol chronic intake also changes microbiome. I think since you are studying, you are more aware about microbiome, how it is actually helping or making a balance in our body. So that chronic alcohol consumption actually changes in microbiome population. So that is reducing the good bacteria and increasing the pathogenic bacteria, which is responsible. The pathogenic bacteria are responsible for secreting some lipopolysaccharides. जिसको बोलते हैं endotoxin. And these endotoxins actually goes into the circulation and reach to other part of the body, including brain, pancreas, liver. So if I give an example with this liver, there are Kupffer cells are present, which is a macrophage of liver. So this endotoxin actually goes and activate these Kupffer cells to and promote inflammation. So we are working on alcohol and gut barrier dysfunction. So what happens? Chronic alcohol consumption is known to cause alcoholic liver disease, but only 20 to 25% of the people drinking alcohol have this disease, fatty liver disease. The reason is we don't know actually. So we are trying to figure it out what is different compared to the 70 to 75 to 85% people who is drinking. So, but what we know that alcoholics patient which is having liver disease, they show endotoxemia. So the source of endotoxemia, endotoxin is colonic microflora, because that is the place where this endotoxin is released. Go back. And moreover, we also know that alcoholics who are having fatty liver disease, they have showed disruption of intestinal tight junctions or increased gut mucosal permeability, which is, you can say, leaky gut. And because of that, whatever toxins are present into the gut, it goes into the systemic circulation and reach to other parts of the body. So our lab is actually understanding chronic alcohol consumption, effect of alcohol consumption on this disruption of intestinal tight junctions, and how that is changing entire microbiome population, and what are the different proteins or channels are involved. Such, you can say, this stress is one of the comorbid conditions, because it's a double hit model. Double hit means one molecule of stress, one molecule of alcohol will not give you 2 molecules of its effect. It gives 4 molecules of its effect. That's a double hit model. So stress is also contributing this alcohol induced barrier dysfunction. Calcium channel, that I am going to show that data. So that is also involved. Defensins, these defensins are present in the gut. So in the gut, what happens whenever a person is drinking alcohol, the level of defensin goes down, and these defensins are responsible for killing pathogenic bacteria. So the level of defensin goes down. So what happens? These pathogenic bacteria will proliferate, and so that is a condition. So we are trying to actually put this defensin back into the system, so that at least we could actually mitigate the effect of alcohol induced gut injury. Probiotics, our lab is also working on probiotics. So Lactobacillus pantosus we are working on, and that is how actually it is mitigating or preventing the alcohol induced disruption of tight junction barrier dysfunction. So interestingly, when we were doing experiment, what we have observed, that when we have given this CACO2 cells, it's a colon cancer cells. So when we have given alcohol and acetaldehyde both, because these CACO2 cells doesn't have alcohol dehydrogenase enzyme, so it is not able to convert this acetaldehyde. So when we have supplemented both ethanol and acetaldehyde, what we have observed, that there is a rapid increase of intracellular calcium. Not intracellular, that just only calcium level. But we don't know this calcium is coming from where, whether it is coming from the inside or the outside of the cells. Then we have used 2 inhibitors. One is thapsigargin. Thapsigargin is usually a blocker for endoplasmic reticulum induced rise of calcium. So if you add thapsigargin to the cells, you are going to inhibit this ER release calcium and calcium free media, where we are not adding any calcium. So when we have observed, we found that thapsigargin is not able to inhibit that rapid rise of calcium. So the calcium, whatever calcium, is not coming from the ER, that is coming. And when we have added this calcium free media, no calcium, we have seen that calcium level goes down. So this indicate that calcium, whatever the calcium was there, that was coming from outside of the cells to the inside, not from the inside to the other compartments. So this raises a question like next. So this was done in Kakadu cells just to measure calcium intensity. But thereafter, we have seeded those cells in transwell. So if you see this model is a transwell model. So we are actually seeding cells on top of this membrane. So this membrane, you can say gut like rod kind of structure, like we have a small intestine. So the internal part, what is happening to the internal part, that we have to figure it out. So if you see this model, this is more of internal part, and this is the basal part, where this whatever toxins are there that can release into the bloodstream. This is just like a depicting the model, actually the physiological model that we can actually recapitulate outside of the body. So because we cannot do many things inside of the body. So these cells are seeded over here, and these cells actually differentiate. So they will actually having the property of intestinal cells. So if you add something on the top, it cannot go down because of the membrane that we are putting here. But as soon as you are going to insult this membrane junction, tight junction, which is formed between the in the mucosal layer, then these molecules, whatever the molecules we have added on the top, it can go down, so that you can measure transepithelial resistance, like how much resistance it is caused, and presence of stimulus, you can say alcohol, how much that TR transepithelial resistance goes down. In addition, the molecules which we have added over here, and absorbance can be taken. So that will give like one experiment, but you get two observation. So this is transepithelial resistance. What we have observed, that there is a reduction in transepithelial resistance in the presence of ethanol and acetaldehyde, which was actually blocked by BAPTA and calcium-free media, but not thapsigargin, suggesting that this calcium was coming from outside of the cells, because this BAPTA is a calcium chelator, it blocks everything. And parallelly, inulin permeability, that is because of that inulin that we have added over here, we have measured how much came into the basal after alcohol administration. Then what we have observed, the ethanol and acetaldehyde increase this inulin permeability in the presence in parallel reduction in transepithelial resistance, which was blocked with the BAPTA but not the thapsigargin. And thereafter, so it means like the transepithelial resistance goes down, it went down, and what you call inulin permeability went up. So we thought, okay, now if it is case, then I think we should go for junctional staining for junctional protein. So what we have observed is ethanol and acetaldehyde disrupt or affecting the redistribution of occludin and ZO1, which are the tight junction protein, because these tight junction proteins are very, very important for prevention of allergen and toxin to go into the systemic circulation. So this one was disrupted in the presence of ethanol and acetaldehyde, but as we have seen that BAPTA and calcium-free media, this disruption was lost, but not with the thapsigargin, suggesting that thapsigargin, the calcium which is coming from the ER is not responsible, but the calcium is coming into the cells that is responsible. So this calcium, in addition, so this is like more of BAPTA and calcium-free media. We have also used diltiazem and ruthenium red, which is also blocked ethanol and acetaldehyde induced tight junction disruption and barrier dysfunction. Thereafter, actually, we looked, okay, so there is a calcium is coming inside, but how calcium can come inside? What are different pathways or channels are involved? So I think there are so many calcium proteins are there, calcium channels, but very, very important, which is present in the apical membrane of this intestinal epithelial junctions. These are CAV1.3, which is a voltage gated calcium channel, and another one is TRPV6, which is a specific for cation for calcium. So when we have knocked down these two channels, TRPV6 and CAV1.3, what we have observed that down regulation of TRPV6 decreases TER, in parallel increases inulin permeability, suggesting that these channel proteins, the TRPV6 is very, very important in the disruption of epithelial permeability, intestinal tight junctions that is found by CACO2 cells. So thereafter we have hypothesized, go to the next. So moreover, actually we have actually stained for these tight junction proteins, and here you can see in the non-transfected cell, ethanol and acetaldehyde induce redistribution of tight junction proteins. And when we have knocked down TRPV6 gene, then we have observed there was no disruption of tight junction, which is like blocking the effect of ethanol and acetaldehyde. Next. So this calcium channel may involve in ethanol-mediated tight junction disruption and barrier dysfunction. So this one we have observed only in the in vitro cells. Then we have hypothesized that whether this deletion of TRPV6 gene blocks ethanol-induced colonic barrier dysfunction and endotoxin absorption in vivo, and whether TRPV6 deficiency attenuates ethanol-induced liver damage. So the model is experimental study that we have used. We have used two strains. One is wild type, another one is TRPV6 knockout. These mice were fed ethanol in a dose-dependent manner, like 2 days for with the 0%, like the acclimatized with the diet actually we have given, and we have then increasingly added the amount of alcohol in the same diet, 1%, 2%, 4%, 5%, and 6%, and that is experiment for 28 days. And in addition, because alcohol gives a calorie, so we have actually control mice were pair fed with maltodextrin just to match that calorie intake should be the same. Only the effect of alcohol we supposed to see. After this experiment, we have evaluated various parameters: gut permeability, endotoxemia, oxidative stress, antioxidant gene expression, and for colonic histopathology, tight junction, adherent junction integrity, liver, ALT, AST level, triglyceride histopathology, and some of the chemokines, cytokines, and antioxidant gene expression. And we have done some organoid related research as well. So after the experiment, so in this one, we have what we have done, we have taken this inulin FITC, which is a dye, and we have injected to the mice the tail vein and allow them to incubate for 1 hour. After that 1 hour, we have sacrificed those mice and we have taken out blood and entire small intestine and the colon. And then we have flushed the entire small intestine and the colon just to collect. If there is a junctional disruption, you are going to see more fluorescence into the flushing of these colon or small intestine, and normalized with blood concentration, because since we are actually introduced to the tail vein, you are going to see in the blood as well. So then what you can see here, the ethanol fed mice in the wild type group, there is an increase in inulin FITC permeability, but this was blocked in TRPV6 knockout mice. And moreover, we have also evaluated lipopolysaccharide secretion. So what we have observed that lipopolysaccharide secretion is more in ethanol wild type group, but not in the knockout group, suggesting that there is a disruption caused by alcohol consumption in the mice who are wild type, but not with the TRPV6 knockout, whether it is a pair fed or the ethanol fed. And thereafter, we have stained for tight junction protein. So you can see these cryo section were stained for tight junction protein, occludin and ZO1. You can see there is a disruption or down regulation of tight junction protein in the ethanol fed group compared to the pair fed, but which was absent in the TRPV6 knockout group. And adherent junction also down regulated in the ethanol fed wild type group, but not in the knockout group, suggesting that TRPV6 deficiency blocks ethanol induced tight junction disruption in terms of tight junction and adherent junction both. Moreover, we have it is reported that ethanol induces inflammation. So we have did real-time PCR for specific genes, which is in terms of chemokines, cytokines, and antioxidants. So here I am showing just only two and the representation of other genes. So you can see TNF alpha is increased, TNF alpha and IL-6 is increased in the wild type fed ethanol fed mice, but it is not in the TRPV6 knockout mice. And this kind of trend we have seen, like IL-10, which is an anti-inflammatory, which is down-regulated, and CCL5, MCP1, CXCL2, which is upregulated in the wild type group, but not in the corresponding group of wild type and TRPV6 pair fed and ethanol fed. And in addition, because of inflammation, we have also seen that antioxidant gene expression is also down-regulated. You can say TRX, thyrodoxin 1, SOD1, SOD2, and NOW2, which is a master regulator of most of the antioxidant gene expression. Moreover, we have stained for phosphosARC. So we have seen that a reduction in the actin fluorescence, but drastic elevation of phosphosARC, which suggests that these phosphosARC are responsible for disruption of tight junction, and which is blocked in TRPV6 knockout mice. So here you can see there is a disruption of tight junction. We have seen junctionals are disrupted, and we have seen there is a more inflammation, more decrease in the antioxidant gene expression, and increasing phosphosARC as well. So these suggested that whether an LPS was increased. So this suggests that if LPS is increased, it is elevated in the ethanol fed, whether it is affecting liver or not. So for that, I'll go back. How much time we have? 17 minutes, okay. I'm going to finish fast. So then we have actually evaluated liver markers, ALT, AST, and triglyceride. What you can see here in ethanol fed group, we have seen there is a drastic increase of ALT, AST, and triglyceride. In addition, histopathological lesions are also observed in the ethanol fed group, but it is absent in the wild type pair fed and knockout group, TRPV6 knockout group. Suggests that ethanol induces inflammation and causes liver damage. Actually, these are the some of the parts I am showing. I am not showing all of them. Next. So then we actually standardize different techniques, which is like a organoid. I think you are aware about organoids. So organoids, actually, these are small organs, you can say, which you can grow outside of the body. So it will have multiple number of cells, because the drawbacks of the cells that we are using, that's a single homogeneous cells. So either you can see it may be enterocytes, it may be Paneth cells, but organoid will have a multiple number of cells. And those cells can be actually evaluated. We can grow those organoid outside of the body, and then we could do multiple therapies or drug we can treat. So there are ways, actually there are different ways you can generate these organoid. One is iPSC, induced pluripotent stem cells. That is also one of them, but I am not focusing on iPSC. There is another one, embryonic based organoids, but here I am talking about adult derived stem cells, adult derived organoids. So what we do, we can take small part of small intestine or colon or whatever the like organs you are interested, and then you can extract or isolate some stem cells for that particular organ, and you can grow those outside of the body, and then you can see these kind of structures. It is not actually this kind of structure. That structure may be very irregular, but these are like just an example. So you will see there are some crypts which resemble here. These are the crypt-like domain, and there are some villous kind of structures. So this organoid, I can say this one organoid from a small intestine that have comprises at least 5 to 6 cells, different type of cells. Either you could actually reprogram this one to differentiate a particular one type of cells, or you can actually grow at like 5 cells at one time. But if you are interested in particular one cells, what is the effect of particular thing on this one cell, then you could differentiate those one into that particular lineage. And so we have used two kind of this one study is micro injection. So go to next. So this is like after when you isolate crypts, these are colon, these are small intestine, and they will make these kind of morphology. Next. So can you just play this videos if it is possible? I think it is changed. So this is a 3D video actually. This is a organoid, one of the organoid, which is stained with actin and TLR4. So if you just move it, you can see 3D structures. I think maybe it's lost communication. So this is for occludine and this tight junction and adherent junction staining. Next. So here we have actually, since we have evaluated the calcium fluorescence in the Cacodue cells, we also have evaluated the calcium fluorescence in the organoid that was generated from small intestine and the colon both. So I think you are not able to play this video as well. Can you see? No, I think it's not working. So I just give you a brief summary. So this is wild type, and this one is knockout colonoids from mouse, and these are the enteroids from the mouse itself. So what you are going to observe, this is a baseline, you are going to see this color intensity, but as soon as you add ethanol, is not going to change anything. You will see this kind of structure. But when you add acetaldehyde, that fluorescence will increase to green. So that suggests that calcium is coming inside, because the calcium is outside. Now you can measure calcium which is coming inside, and that change the what do you call it as color intensity of this one. So but these were absent in TRPV6 knockout organoid, which was generated from small intestine and the colon both. Next. So in one experiment, what we have done, we have taken these organoids and then we have added some dye outside. So these kind of a hollow kind of structures are there. So when you add dye outside, that dye will not go inside, because dye has some molecular weight. It not go if cells are intact. But if cells are compromised, then this dye can go inside. So this is the control. You can see in the time dependent manner, you are going to see there is a less dye is coming inside. So this is kind of a heat map. You have added dye outside, but you are not able to see it is coming inside. But when it was treated with ethanol, so you can see there is a time dependent manner, it is going inside. So that fluorescence we have measured in the presence of 4-methyl pyrazole and acetylcysteine diltiazem, which is a calcium blocker, and this is antioxidant, and this one is inhibitor of ethanol. So we have observed that this effect which was present in the presence of ethanol, which was blocked or absent in these 3 models. So this suggests that ethanol increases the permeability, that is from outside to the inside. But this is not a physiological model. The reason is because the concentration, physiological concentration of alcohol, because you need to add more amount of alcohol outside of this organoid. So you have to be realistic model. So then what we have done, we have taken organoids from different mouse, which is like a already stained with green color and red color, and we have micro injected these dye along with ethanol to see, and then measured permeability. So in the time dependent manner, you can see there is a reduction of this intensity, but in the control it is not. So this suggests that this ethanol disrupt tight junction and barrier dysfunction in the mouse enteroids. Next. And then similarly, so those organoids were from GFP and RFP. Then I have taken generated organoids from the TRP6 wild type and the knockout both, and performed the same kind of study. You can see wild type, there is a reduction or increase in permeability, decrease. Sorry. In this one, there is a reduction, and this one is intact. So the level which I have introduced inside, that is going outside because of the alcohol was present and it is disrupted tight junction. So then I have stained for tight junction proteins, with the in the organoids itself with the ethanol and acetaldehyde and TRPV6 knockout. So it is actually disrupting, but not this one. So this is the overall model that ethanol and acetaldehyde work together and they act on some of the channel. Here I am talking about TRPV6, but it is also acting on CAV1.3 that we are going to see. And because of the more amount of calcium is coming into the cells, that is affecting mitochondria, changes membrane permeability, and causes more reactive oxygen species generation, which leads to SARC activation that I have showed there, that there is an increase in phosphosARC level. And this SARC is responsible for phosphorylation and dephosphorylation of tight junction protein, which is then open the entire junction and it leads to endotoxin absorption and causes liver damage. This is the same model. And as soon as it is open, then this lipopolysaccharide, which is present into the gut, it can release into the blood circulation and causes endotoxemia and causes systemic inflammation as well. Thank you. I think from the entire talk, if you have taken only 10%, that is also I'm fine. Because I know you guys are very naive and doing bachelor's degree. And definitely in the next phase of your life, maybe in the master's or PhD, you are going to learn more and more and more. And that will be more exciting to you guys. Yeah, any questions, anything?
Yes, please.
SARC activation. So SARC activation is actually dependent on the calcium. So when calcium is there, so that calcium is actually changing dynamics. So in terms of actin is there and phosphosARC is an enzyme. It actually phosphorylating. So that calcium is coming inside, that is changing the property of that enzyme. And because of that activity is changing, that phosphosARC is responsible for disruption of tight junction.
Any other
Yeah.
query? Yes.
Yeah.
Yes. Yes.
So, there is a formation of alcohol, oxidation of alcohol by alcohol dehydrogenase forms NADH. Right. So, how much ATP is from this process?
See, there is a reason actually these alcohols are calling as empty calories. So empty calories means that body is not going to store anything. But if NADH is generating more, so then it will lead to other metabolic signals or metabolic cycles. So I don't know how much ATP is generated from this one, but definitely it gives more amount of calorie. So calorie means they are getting more energy and it is generating ATP. But that ATP is not stored anywhere. So they are actually releasing in terms of as soon as that level is disappear.
Anyone else? Yes.
No, actually. It is not actually the chemical composition. Alcohol is like it is actually mixing with the drug actually, which is prescribed. But when people are taking medication also, so when you drink alcohol, it is actually nullifying the effect of that particular drug. So there is a dextra something is there, which is actually responsible for relieving cough. So these, some of the chemicals or some of the drug are not actually soluble in some of the component or solvent. So alcohol is one of them, which is like everything is soluble because it's a water soluble and fat soluble both. So when you are getting, but those alcohols which is present in the cough, these are not prescribed to the children's. I think that is prescribed only to the adult. But that amount is not going to affect anything. Because anyways, you are taking some medicine which is going to relieve, and anyway, this alcohol, whatever drinking in the time of this cough syrup, that is also going to be metabolized very fast because very small amount is there. And even in the mouth also, they are going to metabolize. Yeah. So hangover is because of the more production of acetaldehyde. So, and sometimes people are saying that after they are getting hangover in the morning, they are asking, okay, eat this, eat that, so it will suppress the hangover. It is not the case. it is not going to help. Only time will help you. As soon as you are abstain from alcohol, that is going to help you. But the acetaldehyde, which is because person is drinking more, and because of that, the enzyme, that alcohol dehydrogenase, because liver has a capacity to metabolize 7 grams of alcohol per hour. But if person is drinking more, then I already told you there is another pathway will be activated, that is CYP2E1. So that CYP2E1 will generate more acetaldehyde, and that acetaldehyde will always be circulated in form of vapors in your body. And as soon as this acetaldehyde will go away, then you can actually come to the normal life from the hangover. So it's not going to help anything whether you are going to eat curd bolte na, dahi kha lo, nimbu kha lo, that is not going to help. Only the time will help you. Yes, if you are drinking, if someone is drinking, if they will eat something before drinking, that's a beneficial, because you are going to delay the absorption of alcohol. But if person is empty, they are going to get that symptoms of alcohol effect in terms of good, people says, that will be like very fast. But hangover will be because of the acetaldehyde accumulation in your brain. Anyone?
अल्कोहल को हम कंट्री से बैन कर सकते हैं?
Very good.
छोड़ के बात करता हूँ.
Very good question. So actually there are some countries, they have putting a label. आप बैन की बात कर रहे हो because we are getting a lot of money. Some states they have already implemented, Bihar, Gujarat, but कुछ countries में there are some people like volunteers. What they are trying, कि if we can actually put a label, like the person who is smoking, they are seeing that on this cigarette butt, जो उनका बॉक्स है उसमें लिखा था अल्कोहल किल कैंसर और अल्कोहल कॉज कैंसर, ठीक है, उसमें एक वो शायद लंग का भी फोटो दिखाते हैं, आई थिंक, राइट? सो some companies actually they have put it, and in that particular reaction, the person who is like involved in these kind of alcohol business, they ask government to stop it. So it is very, very, very difficult to actually stop alcohol, because it is countries are depend on economy, and alcohol is one of the contributing factor to increase the economy. And I think best is to avoid or just to aware the people, because awareness is very, very important. What is going to be happen to you if you are drinking in a small, large, or in a party? That is up to the people, actually they decide. If they will decide that people will not drink, then definitely someday they are going to stop it. But if they are drinking, whenever companies or government are putting taxation, even if it is 100 bottle, 100 rupees per bottle, if it is 200, the person who is drinking will go purchase it. So we have to be that we should aware these people that what are the complications, what are the problems you are going to face in terms of family, individuals, or entire society or nation. Yeah.
But it said that if you use vomiting, false vomiting, it also helps to reduce the effect.
See, vomiting is coming from where? Vomiting is coming from the gut, right? Stomach part hai. But blood is circulating in, the alcohol is circulating in the blood. It is everywhere. So it is, I already mentioned you, it is there that the person blood concentration of alcohol is similar to the concentration of alcohol present in the colon, small intestine, or brain, whatever the organs you say, it is same. But vomiting is not going to help. Vomiting is like relief if someone has eaten something, if it is blocking or they are feeling very uneasy because of the gastric secretion that is stomach is doing. So, but that is not going to help. Forced vomiting is not going to help anything. It is going to be worse, actually. The person will like suffering, oh my God, what I have done.
Calcium peak came after 15 minutes of drinking alcohol, but after how much time it came back to its normal concentration of calcium?
Normal calcium, that I have not investigated. It's a nice question, actually.
small amount of alcohol will increase the bone calcium density. This becomes a positive. No, calcium actually good for health, but see here I am talking about the alcohol. Alcohol increases the calcium which is not required, and the person who is drinking alcohol, it has been some reports are available that it is causes osteoporosis as well. So calcium and vitamin D regulation is always important to make a create a homeostatic environment, but the extra calcium which is coming into the cells, which is also causing oxidative stress, and it is not good for the health.
The effects of alcohol on female reproductive health many times, and but does it also affect male reproductive health? Yes.
See, in terms of if I say alcohol, so alcohols do, it is increasing calcium, and that is also affecting sperm formation in the male reproductive organ. So it is actually debatable, like how alcohol is affecting reproductive into the female and in the male, but it is definitely decreasing sperm count, alcohol, into the male reproductive organ. And female may that increases estrogen level during menstrual cycle. So that is affecting definitely, because of that increases breast cancer as well.
Any other query? Question?
Someone said that drinking beer may lead to release the stones in the kidney, and there's some misconception, or I don't know what is that. It's improve or it's had to protect us from heart attack.
Beer. See, this was a previous statement actually people were saying, but new studies are saying that no, it is not. So I agree, actually people say like person who is depressed. So alcohol is an antidepressant. Okay, so when person start drinking to reduce that stress or reduce that depression, as soon as they will relieve that alcohol, that level goes up, again they will be more depressed. That's actually a continue process. This is a depression level. When person is drinking, it is maybe masking that effect. But as soon as that alcohol wears off, this depression will go up. And now you are going to take more amount of alcohol to again like relieve from depression. That is a case increasing because of level, because people are having this increasing serotonin, dopamine level, and that is also changing the mood. But the first, like the person who started drinking, that neurotransmitter is that level. But as soon as they will increase that concentration, the level of these transmitters, actually neurotransmitters, are disturbed. So it is not balanced. So it's a antidepressant, but in the long term, it is causing more depression, more anxiety.
Any other query question? I know यहाँ पे बहुत से students है, बहुत query है इसको लेके, आप पूछ सकते हैं. This is the right time to ask the question.
You can ask me after this session as well. I'll be here for 10-15 minutes. Done? Okay.
Thank you, sir.
Thank you, sir, for your insightful words. They have truly enriched our day. I trust everyone found our speakers' enlightening address genuinely inspiring. Now, as we approach the culmination of this event, I would like to request our conveners, Dr. Sandhya Rai ma'am and Dr. Jitendra Kumar sir, to present our guest speaker with a memento as an honor of respect and appreciation.
Thank you. Thank you.
As you all know, yesterday, a poster making competition was held on theme Alcohol Abuse Harms Tissue, Health, Family and Society. I would like to request Ask speaker, sir, to please announce the results for the competition.
Where is it paper? I'll start from, this is third, right? No, I'll start from third. First. So third prize for the competition actually was held yesterday. Her name is Anshu Yadav, BSc Honors Zoology. Second position by Mahek Mahajan. First place from the competition is Srishti, first year.
Thank you, sir. I would request our conveners, speaker, sir, and all the winners to please come on the stage for a photograph.
Don't be a drinker, be a thinker.
Dr. Savita Singh from Department of Economics, Deshbandhu College, and Dr. Rushika Joshi from Department of Physics were the judges of the event. And thank you all the participants who participated in this competition.
Congratulations.
Thank you, sir. Thank you, ma'am. A heartfelt thank you to our conveners and coordinators for their hard work and dedication. As we come to the conclusion to this enlightening session, let's express our gratitude. I invite Sir Mohammad Shehzad sir to join us in extending a heartfelt vote of thanks.
Thank you, Akansha. It was a really very nice talk with you by the Dr. Avtar Singh Meena sir. And on behalf of this organizing team, I would like to extend my great heartfelt gratitude to the Dr. Avtar Singh Meena for his very interesting lecture on alcohol awareness program. Also, I would like to thank the principal of Deshbandhu College, Professor Kamal Kumar Gupta. He is always there as a he's a constant source of energy for all of us. I also thanks the IQAC coordinator, Dr. Aditya Saxena sir, the teacher in charge of Zoology department, Professor Indrakant Singh. I also like to thank the Dr. Monica Majaz from Computer Science, Dr. Anjana Singh for Botany Department, and the faculty members of Zoology Department, Deshbandhu College, especially the present here, Dr. Rahul, Dr. Rocky sir, all the non-teaching staff who help us to conduct this event, and especially the Prempal ji. He is always there to support us to organize this event. But last, not the least, all of these students, dear students, आपके बिना नहीं possible था ये. Thank you so much. Now we can stand for the next. Yes. Yes.
The link we are sharing. For the certificate of
Now we can stand for the national anthem. Thank you, dear students. Thank you so much for coming here. Thank you, sir.
Thank you so much.
Thank you so much, sir. Thank you very much. And thank you all students. Thanks a lot.